A common household product posing a danger to your kids. I'm Tisha Powell.
And I'm Lee Zurich. We're talking about dusting, a form of inhalant abuse where users, often teens and young adults, intentionally breathe in chemicals from aerosol products like computer keyboard cleaners. Dusting, a type of huffing, has been around for decades, but now there's concern social media and a lack of awareness about the risks could cause a resurgence among young people.
Reporter Heather Graff shares one family's plea, plus the fight for restrictions on where and how these products are sold.
It is something that we will never, ever get out of our heads. We don't have children to bury them.
The grief is still raw, and memories of 19-year-old Rena O'Rourke are all that's left.
She lit up the room. She was vivacious and caring and loyal.
Yet what her parents, Dana and Aaron, really want you to know is how Rena died.
I think a lot of kids just look at this as, well, it's not drugs. We're not doing drugs, so it's not that big of a deal, and we can get a high from it.
A dangerous high from something known as dusting, which involves inhaling aerosol duster sprays such as those used to clean computers and keyboards.
It's cheap. There's no ID required. It's odorless. It's everything kids look for.
Before it took their daughter's life, the O'Rourkes admit dusting is a term they'd never heard of. So initially, it raised no red flags when Dana says Rena and her boyfriend had this common household product delivered right to her front door.
They had DoorDashed a dual package of keyboard cleaner to my home. She says, "Can I have it?" And I said, "Well, sure," thinking they were using it properly.
They aren't sure if that specific aerosol canister is what killed her. But in May 2025, Rena was rushed to the hospital after she lost consciousness due to dusting.
She never regained consciousness.
It's really scary.
Dr. Randy Wiseman leads the team that tried to save Rena here at Honor Health Scottsdale Osborne Medical Center in Arizona.
When they inhale these chemicals and the gas, it'll actually replace the oxygen within their lungs and within the rest of their body. Several other teenagers have succumbed to this. I fear that they may not see this as something that could cause them harm.
I was really in the dark on all of this.
Claudia Dimmitt lost her son Brandon to dusting back in 2012 and founded the nonprofit organization Families United Against Inhalant Abuse in an effort to raise awareness.
Do you think there's a lot of parents who have no idea of the potential danger of this common household product?
I would say yes. You don't believe that it is as dangerous as it is until it happens, to your family.
Claudia has also pushed for sales restrictions, such as requiring retailers to keep aerosol dusters behind the counter, capping how often they can be purchased, and stronger warning labels, because she believes easy access to these products is a big part of the problem.
My son had 10 cans that he bought, and you just think, who needs 10 cans of duster? It's very obvious it's not being regulated.
In 2021, her nonprofit filed this petition with the Consumer Product Safety Commission asking for action to address duster inhalant use. And there was some progress. In 2024, the CPSC announced a notice of proposed rulemaking aimed at limiting the amount of certain toxic chemicals, such as difluoroethane or DFE, from being used in aerosol dusters. The agency cited data that found nearly 22,000 ER visits for injuries and more than 1,000 deaths from aerosol duster inhalation between 2012 and 2021, and noted the number of fatalities is almost certainly an underestimate. But after recent CPSC leadership changes, in August 2025, that proposal was withdrawn, along with several others that, quote, no longer align with agency priorities.
it's just really hard, you know.
A setback at the federal level, but Claudia says she's been encouraged by recent updates at the state level. Minnesota, as of 2025, requires aerosol duster products containing DFE to be kept behind store counters. The law there also prohibits sales to anyone under 21 and limits purchases to 3 cans at a time. And in Oregon, similar legislation took effect in 2026, though the minimum age requirement in that state is set at 18.
So, you know, some changes are happening, but not enough.
Not enough for Claudia.
To look at your kid laying there, she's not coming back.
And now, not enough for the O'Rourkes.
Had I known this and I saw those cans that were delivered to my door, my response would certainly not have been to hand them over. Perhaps I could have saved my kid. Talk to your kids, educate your kids, know what they're doing.
All right, so what should parents be looking for, and how do you talk to your kids about all of this? For those answers, we sat down with an adolescent addiction specialist and pediatrician at Children's National Hospital in Washington, D.C.
The part of the brain that is interested in experimenting, trying new things, pushing boundaries is growing rapidly in adolescents. However, the brakes are not quite present there. And so I really urge parents to serve as those brakes.
Dr. Tucker says dusting and other forms of inhalant abuse can start really young because, again, it's relatively easy for kids to get their hands on those common household items. So she says middle school would be a good time to discuss the dangers. As for what to keep an eye out for, it might start with changes in your child's behavior, such as increased anxiety, irritability, nausea, dizziness, and loss of appetite. Other red flags would be a chemical odor on their breath or clothing, rashes on their face, stashes of plastic bags or smelly rags, and of course, empty cans of keyboard cleaner or aerosol dusters in their rooms.
If they notice any of that, that would be an urgent concern, and to bring that to their pediatrician or a healthcare professional, because even the first time use can be deadly.
For more resources and advice for parents, just head to InvestigateTV.com and search dusting.
We also reached out to the Household and Consumer Products Association, or the HCPA, a trade group representing companies that make and sell cleaning products.
In a statement, the organization said no one wants to see products misused in a way that leads to harm, but added that consumer education about the dangers will have a more significant impact than a product ban.
When the Consumer Product Safety Commission previously considered a rulemaking on this, the HCPA said it recommended regulations modeled after Minnesota's law, which imposes age and quantity restrictions along with behind-the-counter storage and retail outlets.